We've brought you a number of stories on the devastating Ebola outbreak in the Democratic Republic of Congo. But the end of June brought good news. The World Health Organization announced that the outbreak was over. Special correspondent Monica Villamizar spent time in the province of North Kivu when the outbreak was raging and health workers were caught in the middle of a deadly war. Tonight, in partnership with the Global Health Reporting Center, her latest report on the new health challenge there, COVID-19.
In the late spring, these health workers were still going door to door, visiting contacts of the last known Ebola patients.
How is your head? And are you vomiting?
Asking questions and checking for fever.
Your temperature is good. We'll be back tomorrow to check it out.
This was the final chapter of the Ebola epidemic that rocked North Kivu, killing more than 2,200 people in the last 2 years. The Ebola treatment centers, once overflowing, now sit empty. But even as children turn this one into a makeshift playground, there is no rest for the weary. The new threat is coronavirus.
We saw that in the West, COVID-19 is killing hundreds of people a day. It's even more dangerous than Ebola. We're very afraid.
I met Jean-Jacques Muyembe last year when he was leading the charge against Ebola. He helped find the first effective treatment. But now he's heading up the nationwide effort to contain COVID.
Ebola showed that politicians need to call on scientists in a crisis, and the scientific community should not disappoint.
The first case was identified in March in Kinshasa, the capital, a city of 12 million people. A lockdown began 3 weeks later. But after fierce complaints, it was loosened in mid-May, even as new infections kept going up.
Anne
Rimoin is an American epidemiologist who has run a research and training program in DRC for nearly 20 years.
The real picture of what's going on in the interior of the country is very, very difficult to paint at this point without widespread access to testing, really good disease surveillance, and an understanding of what's happening on the ground.
Despite vast mineral wealth, including gold, diamonds, and cobalt, or in part because of that wealth, DRC has a long history of suffering. Brutal rule by Belgians, local dictators, corruption, poverty, and civil war. Life expectancy here is amongst the lowest in the world.
What's the state of the health system in Congo right now?
The health system is very weak, very weak. And outbreaks are detected very late because the health system doesn't work very well, doesn't function.
But Muyembe says success against Ebola shows it isn't hopeless.
What's the message for you to tell the world now about Ebola?
Now we have the vaccine, we have treatment. Ebola is now a curable disease.
In late June, the 2-year outbreak was declared over.
We'll have small outbreaks, sporadic outbreaks, but it will be quickly controlled and not with a high lethality like we have now.
Jean-Jacques refers to me as his daughter. My wedding photo is in his office. Moi, je n'ai pas une...
Rimoin has been working alongside Muyembe since 2002, trying to build up DRC's public health capacity, training doctors and nurses to spot and respond to outbreaks.
It isn't parachute science that's going to save the day. It's going to be investing in people like Jean-Jacques Muyembe and all of these young scientists that he's trained over time, who are really the future of outbreak prevention and control.
Rimoin says the critical challenge is to stomp out epidemics while they're still small.
You get it at while it's still just a spark.
Yeah.
Because once you have a wildfire, it's very, very difficult to contain.
That's exactly what happened with the Ebola outbreak in eastern DRC. Containing it took more than 2 years of grueling effort in the midst of a civil war. That fighting in North Kivu hasn't stopped, and healthcare is still what you call low-tech.
Congo is not a place where you are going to have great access to vaccines and therapeutics early on. The key in a place like the DRC is having adequate access to testing, contact tracing, being able to isolate individuals who are sick and to quarantine the people around them.
In DRC, the vast majority of coronavirus cases are in Kinshasa. In North Kivu, cases are still rare, but they're getting ready all the same. Here, making masks. These people told us they hope the hard lessons of Ebola will stick.
We should respect the social distancing, and they tell us not to forget washing hands like we were doing for Ebola prevention.
This is a disease we can't resist. It can kill us all.
In a place where nothing comes easy, COVID-19 could prove to be the hardest test so far. I'm Monica Villamizar for the PBS NewsHour.